In this video, I will go over 5 NCLEX style questions with answers and extensive reviews. I will be asking you questions with pauses in between. It's like a virtual study buddy and flashcards for your ears. Okay, let's begin. Question number 1 and 2 are based on the following scenario. An 84-year-old woman is brought to the hospital by paramedics after she was found on her apartment floor by her neighbor. The client explains that she stripped and fell down last night while getting up to go to the bathroom and estimates that she was on the floor for 6 hours before being found. She complains of feeling weak, but denies having any pain, and there is no evidence of trauma. Her vital signs are temperature 98.9 degree Fahrenheit, BP 130/80, heart rate of 75, respiratory rate of 20, 95% on room air. Her labs are shown below. You can pause the video to review the labs. Based on the finding above, which condition does the nurse suspect the client may have developed? A. Urinary tract infection. B. Hematuria. C. Rhabdomyolysis. D. Delirium. Question number 2. Based on the finding, which interventions should the nurse anticipate? Select all that apply. A. Aggressive IV fluid resuscitation. B. Administer IV insulin and dextrose. C. Insert an indwelling Foley catheter. D. Administer sodium bicarbonate to decrease pH level. E. Obtain a 12-lead EKG. Do you have the answers for question number 1 and 2? Okay, let's go back to question number 1. It is asking us to pick a condition that the client may have developed based on the findings. Let's start with the answer choices and see if we can rule them out one by one. A. Is this a urinary tract infection or UTI? Does the client have dysuria or pain with urination? Urinary hesitancy? Does she have elevated WBCs or a urinalysis with many WBCs and bacteria? The answer is no. None of these are mentioned in the scenario, so we can rule out UTI. Is it hematuria? What is hematuria? Hema means blood, and urea means urine, so hematuria means blood in the urine. For a positive hematuria, there is usually presence of a lot of red blood cells and blood in the UA. If there is presence of blood, but a few or no red blood cells, it is usually from the presence of hemoglobin or myoglobin from cell death, such as from hemolytic anemia or rhabdomyolysis respectively. So we can rule out choice B, hematurua, since there are no red blood cells found on the UA. Choice C mentions rhabdomyolysis that is consistent with the finding on the UA, which is the presence of blood without red blood cells. What else do you remember about rhabdo? If you recall from my video on rhabdo, you know that acute kidney injury is the most common complication of rhabdo, and there is also shifting of electrolyte causing hyperkalemia and hypocalcemia. Let's go back to the labs. Which lab value tells us about kidney function? Yes, creatinine. What is the normal creatinine level? Yes, 0.6 to 1.2. This client has a creatinine level of 2.0, which is very elevated for somebody without a history of kidney disease. What about potassium? Is it elevated? Yes, normal potassium level is 3.5 to 5. Any other labs that may also indicate rhabdo? Yes, the CPK level of 7,000. CPK is the most sensitive test for rhabdo. It is an enzyme found primarily in heart and skeletal muscle and leaks to the bloodstream with muscle injury, which is what happens in rhabdo. CPK levels of more than 5,000 have increased the risk of the development of AKI. So answer choice C is the correct answer. Choice D says delirium, which is not consistent with presentation, as the client was able to recall and provide detailed information about the event. Okay, let's move on to question number 2. Now that we know the client has rhabdo, which interventions, as a nurse, would you implement? As mentioned earlier, acute kidney injury or AKI is the most common complication of rhabdo. How would you treat AKI? Yes, hydration. Kidneys love water and hydration. Giving IV fluid or encouraging patients to increase fluid intake can help increase blood flow to the kidneys and treat AKI. And sometimes, rhabdo patients may need sodium bicarbonate to alkalinize the urine, since substances like myoglobin and uric acid can precipitate and cause damage in the renal tubules. What about hyperkalemia? What can it lead to? Yes. For any potassium and calcium imbalance, always think of the heart, as they can cause deadly cardiac rhythms such as peaked T-wave, prolonged QTC. To treat hyperkalemia, there is usually a cocktail of giving IV insulin and dextrose to push the potassium back into the cells, and calcium gluconate to stabilize the cardiac membrane. So answer choices A, B, E are correct. Even though strict I and O should be monitored, routine insertion of an indwelling catheter is not required. D is also incorrect, because sodium bicarbonate increases pH level, not decrease it. Okay, moving on to question number 3. What are the classic triad symptoms of rhabdomyolysis? Let's look at the answer choices. All of the answer choices have weakness, and weakness is one of the triad symptoms of rhabdo. All 3 answer choices have myalgia, which is what? My means muscle and algia means pain, so myalgia means muscle pain. Is it a symptom of rhabdo? Yes, it is. Rhabdo is the breakdown of skeletal muscle cells, so it is not uncommon to have muscle pain. So we can rule out choice C and also choice A because it says muscle pain, which is repetitive. So we have B and D left. Is it hemoglobinuria or myoglobinuria? Hemoglobinuria means presence of hemoglobin in the urine, and we know hemoglobin is part of the red blood cells and not muscle cells. So the correct answer is D, weakness, myalgia, and myoglobinuria, which is the presence of myoglobin in the urine. Myoglobin is also a hemiprotein, and it gives the urine a dark tea-colored appearance. Myoglobinuria is only seen in the rhabdo. Question number 4. Which clients are at risk for getting rhabdomyolysis? Select all that apply. From my rhabdo video, we know that risk factors like trauma, immobilization, strenuous exercise, infection, and some medications can cause muscle breakdown and lead to rhabdo. Let's keep them in mind while we go over the answer choices. A. A client who is on muscle relaxants. No, that is incorrect because persistent muscle contraction can lead to rhabdo. While relaxing, the muscles can help prevent that. B. A client who is on statins. Yes, statins are lipid-lowering medications like atorvastatin. It is common to have mild muscle pain with statins, but intense pain can indicate rhabdo. C. A client who takes aerobic classes. Strenuous exercise can cause muscle breakdown, but it was not indicate that in the answer choice, so I would not say this client is at risk. D. A client who just had status epilepticus. Status epilepticus occurs when a seizure lasts for more than 5 minutes, or there are back-to-back seizure activities. That definitely is a risk factor as muscle breakdown can happen during prolonged seizures. E. A client who just underwent an extensive surgery. Yes, prolonged immobilization such as prolonged surgery and bedridden clients are all risk factors of rhabdo. Question number 5. The nurse gives IV fluid to prevent acute kidney injury in a client suspected to have rhabdomyolysis. Which finding by the nurse indicates success? A. Urine output of 200 to 300 ml per hour. B. Crackles in the lungs. C. Edema in bilateral feet. D. Normal sinus rhythm on telemetry. The correct answer is A. Aggressive IV fluid resuscitation is given to prevent and treat AKI in rhabdo, and a urine output of 200 to 300 per hour is the goal. What is the minimal amount of urine output per hour that indicates adequate renal perfusion? Yes, always remember, 30 ml per hour is the minimum for test purposes. Choice B and C are both symptoms of fluid overload, and choice D is not relevant. Thank you for reviewing the questions with me. Like and comment below if you want to see more review videos. See you next time.